name is Rachel Chege, and I'm your host for the collegiate edition of Developmental Milestones for the school-aged child, ages 6 through 12. And these are our contestants,
Kelsey, Emily,
and we'll just jump right in. So our categories are normal, abnormal, child maltreatment, delayed milestones, parental involvement, anticipatory guidance, and screenings. What would you like to do first?
I'll do question number 1 for normal.
Okay. Name 3 things that are normal gross motor function. All right, Emily.
Walking, skipping, and what about like throwing a ball?
Perfect. All right, shall we just go down the line? Second question. Name 3 things that are normal fine motor functions. Yes, Kelsey.
Buttoning a button, writing your name, and feeding yourself with a fork.
Very good. All right, name 3 normal cognitive functions. Yes, Kelsey.
Abstract thinking, problem solving, and reasoning, and cause and effect.
Very good. All right, next question. Name 3 normal language findings. Yes, Emily.
Okay, so them speaking in full sentences,
Yes.
being able to have like social speech, being able to talk in social settings, and then having a vocabulary greater than 50,000.
Perfect. All right, next question. Name 2 normal emotional findings.
Thinking of that.
Okay. Emily.
I would say if they're not showing any fear, that would be one. And then what about being able to effectively talk with like an adult and have that communication with them?
Perfect. Okay, last question for this category. Name a social norm. Yes, Kelsey.
Being in a sport,
Yeah.
like participating in a sport or
Yep.
something.
Group activities.
Okay.
Very good.
Cool.
All right.
How did we do?
Very good. What category should we go to next?
Let's do, maybe move on to abnormals.
Okay.
What do you guys think?
Yes.
Abnormals. First question. Name 3 abnormal gross motor findings. Yes, Emily.
So that would be the inability of them to walk or skip or throw the ball, like we had talked about.
Very good. Okay. Name 3 abnormal fine motor findings. Yes.
They can't feed themselves with a fork. They're unable to write their name, and they can't brush their teeth.
Very good. All right. Name 2 abnormal cognitive findings. Yes, Emily.
I was trying to beat you. Okay, so they're not able to problem solve, and then they can't really differentiate between things that are real and things that are not real.
Very good. Name 2 abnormal language findings.
Okay, so again, that would be kind of like what we talked about in the last. So they'd have broken sentences, they're not able to speak in full sentences, and then they'd have the less than the 50,000 word vocabulary.
Very good.
They should have.
All right. Name 2 abnormal emotional findings. Oh,
Gosh.
Maybe some aggressive behavior towards others. And what about not being able to emotionally connect with like family members and friends?
Perfect. All right. Last question for this category. Name 3 abnormal social findings. Yes, Kelsey.
They have trouble making friends at school, so they don't have many friends, and they feel lonely, so then they feel isolation, and then because of that, they're kind of withdrawn and unhappy and might be a little depressed.
Very good. All right. We'll go on just to the next category. Delayed milestone treatment. So if they were abnormal findings, what would we do to treat those? First question. How would you treat abnormal gross and fine motor physical milestones? Yes, Emily.
So this would be when we would start probably, referring to physical therapy and occupational therapy. You could refer them in office and start getting some things set up with them. Slowly seeing if they can make
question, how would you treat abnormal cognitive function? Kelsey.
So maybe referring to speech therapy, they can do a lot with memory, and they can teach cause and effect, and also cognitive behavioral therapy as well.
Perfect. Third question, how would you treat abnormal language findings? Yes. Emily.
Maybe some speech therapy too.
Yes.
Seeing, yeah, they could work with them, especially if they're not meeting the 50,000
Exactly.
cut off.
Fourth question, how would you treat emotional abnormal findings? Yes.
What about cognitive behavioral therapy? So counselor or working with a psychologist or psychiatrist,
Yes.
they needed that.
Exactly. And last question for this category, how would you treat abnormal social findings? That's that social withdrawal and abnormal behavior. Yes, Kelsey.
Seems to be a common theme, but maybe again cognitive behavioral therapy.
Correct. Counselors and such.
Yeah, you can work with them and talk with them about that.
And I think it's also, just to add into this, like, not only should we be monitoring for these delayed milestones in the office, but they're in school now, so parents need to be talking to their teachers, and teachers need to be monitoring for this as well, so that something's not being missed,
Yeah.
so that we're treating these children appropriately.
Very good. All right, next category would be maltreatment. So, ready?
Mhm.
Types of maltreatment.
Okay, I think I got this. Let's say abuse, neglect, failure to thrive. Could do, like sexual abuse, and then emotionally abusive.
Very
Did I get
I want to add something.
Oh.
Yes.
Go ahead.
No, you're okay. You're okay.
So she said abuse and neglect, physical, but it can also be emotional, mental, all those things can be impact a child as well.
And failure to thrive.
Yep.
Okay. Good. Signs of physical abuse. Yes, Kelsey.
Black eye,
Mhm.
abnormal bruising,
Mhm.
a torn upper frenulum,
Mhm.
and bite marks,
Mhm. Anything else?
spanking, which is a no-no, so slap marks, hand marks, or
Perfect.
On the cheeks or on the
yeah.
bottom.
Exactly.
Yep.
Signs of neglect for this age group. Yes.
Maybe the child coming in being dirty and malnourished, having them being exposed to, illegal substances in the home having poor heating and cooling, maybe parents leaving kids that are less than 12 at home by themselves, and then you could also go on to say if you're noticing any patients coming in the office, if it's cold, now that it's getting cold out, and if they're still coming in with shorts and short sleeves and no hats and gloves,
Perfect.
that could be some signs of neglect too.
Excellent. Signs of sexual abuse.
Maybe some reddened, in females like reddened labia. In the males, maybe you could see some loss of the sphincter tone, and loss of ability to control, their bowels, and then maybe some heightened sexual awareness. Yeah.
I'm not wanting to go home.
Yeah.
All right. Signs of emotional maltreatment. Yes, Kelsey.
Depression,
Mhm.
social withdrawal.
Mhm.
They might not have a lot of friends, which may lead to the depression, and then also just a low self-esteem, and again, fear of being with the abuser.
Good. Signs of failure to thrive.
I'd say lack of weight gain, seeing when we're looking at, the growth chart. If they're not gaining weight or they're losing weight significantly, that could be a sign. Having learning disabilities, you know, they're noticing at school that they're getting behind, not really keeping up with the reading and the math that's being taught. And then maybe delayed in developmental achievements. Talking about those things we looked at, normal and abnormals. If we're seeing a ton of abnormals, that could be a potential sign, you know.
Very good. Name 2 intentional injuries that children sustain in physical abuse. Yes.
Abdominal and head,
Very good.
because they're often able to be hidden very well. You know, you can cause head trauma, and you're not able to see it in the office right away. And same thing with abdominal, you can kind of put clothes over it. So that's oftentimes why they'll do that. That's why we have to, specifically the abdominal, making sure that they're, you know, completely down and just underwear with the gown and looking at the front and the back, being very,
And paying attention to those abnormal, like stomach aches.
yeah.
Because I had a patient in the hospital that was actually having physical abuse by the father. He kept punching the child in the stomach, and the child was coughing up blood, and we couldn't find a reason until we actually caught him doing it. So yes, abnormal. It'd be abdominal and head injuries.
Yeah, because it's hard to see, you know, on the outside. Yeah.
All right, typical sites of non-abuse injuries. Yes, Kelsey.
So this would be just like injuries you'd see from a child falling off a bike. So like bruises on the shins or the elbows or the knees, somewhere obviously like they fell off their bike or off the swing set or something that you can easily see.
Yeah.
So, good. Now, if you suspect any of these kinds of maltreatments, what is your plan of care? Yes.
Report it.
To whom?
You need to call DCS by law.
Okay, very good. DCS or CPS, right?
Yep.
Very good.
And then you can also call one of the people in Fort Wayne that can kind of help if you suspect any sexual abuse. I can't think of their names. The people that are trained, SANE nurses, can come in and help with assessment, and really help, you know, a child that age go through that.
Very good. All right, next category, anticipatory guidance. All right, number 1, name as many things as you can that can pertain to a 9 to 10-year-old safety.
There's a lot.
Okay, go for it.
Wear a seatbelt in the car.
Mhm.
They need to be sitting in the back seat until they're at least 13, because that's safest. Wearing a helmet when they're riding a bike or skating or skateboarding or skiing or whatever they do for fun. Wearing sunscreen when they're in the sun, at least an SPF of 15. And then they need to ask to go home if they're put in an uncomfortable situation at a friend's house or a party. Being able to differentiate when they're comfortable and when they're uncomfortable. And then also knowing that it's not appropriate for any older child or adult to ask to see or to touch their private parts. I think at this age,
They should know it's private.
They should know it's private, and there's also some embarrassment that goes with that. So we need to kind of educate what's right and wrong as far as that.
Very good. All right, next question. True or false? Should you tell an adult if you are being picked on or bullied at school? Yes.
Definitely true.
Very good.
So we need to be able to talk with the patients and, you know, telling the school-age child that that's important, that signs of bullying, you know, if it's not okay for others to be picking on you for, you know, how tall you are, how short you are, the size of your ears, and that if these things are happening, to be able to speak up to your teacher, but also to your parents, to make sure that, you know, it's being addressed appropriately instead of waiting until and keeping it bottled in, because a lot of kids will keep it bottled in and not tell parents.
Because they're afraid that
They're
they won't
afraid.
be believed.
Yep.
All right, and then that goes along with parents should always believe a child when they're reported to.
Yeah.
All right. Name 3 examples of things a 10-year-old child should avoid in their diet. Ooh,
So it's
Pop,
yes.
juice, high-fat foods like candies or fast food, junk food in general.
Very good.
carbs. Kids are wanting to eat this these days.
Yeah, so having a high amount of supervision for those.
Yes.
How much physical activity and screen time should a 9-year-old child get daily? Yes.
So for physical activity, we want them to get at least an hour of physical activity. And then for screen time, we want them to get about less than 2 hours for sure. Obviously ideal if it's even less than an hour.
Perfect. All right. True or false? Is it necessary to brush your teeth once per day in the morning? Yes.
False. They should be brushing their teeth twice a day, morning and night, and they should be going to the dentist every 6 months for their cleanings and checkups.
Perfect. All right. That's it for that category. So we're going to move on to parental involvement. First question. Name examples of ways a parent can help their child develop appropriately. Name as many as you can. Yes.
Okay, so I would say supporting their child and encouraging them to try new things. So sports, clubs. At this stage, schools are starting to offer a lot more clubs. So encouraging them to do those types of things, and along with that, teaching them how to help others. So whether that's at school, whether that's signing up for, being involved at food pantries or soup kitchens as a family, it's very beneficial. Understanding that at this age, they're, it's okay to start giving them some space, giving them time to work on themselves, emotionally, and so, knowing that, you don't have to be directly beside your child at all times at home. Let them have some space and let them explore, and encouraging them to use their words when angry. So an example with that is instead of throwing a temper tantrum that they oftentimes did when they were younger, really encouraging them, saying if they're upset, use your words, tell me why you're upset and what you're feeling. And then at this age, introducing chores. So having them, doing a chore list or having them make their bed, sweep the floor, starting to show them how important it is to start being able to take care of these things.
I want to add something, especially with the growth of social media and kids having phones at the age of 7, 8 years old. Parents, I think, at this age need to have, like she said, give them their own space, but also have an appropriate amount of supervision over what they're doing on their phones and what they're doing on their internet, and having the discussion about, again, what's comfortable, uncomfortable, safe, because they're starting to notice changes in their body and they're seeing these things on social media, so we need to have the conversations about the uncomfortable things of puberty.
Very good. Puberty is a good thing. All right, second question. True or false? Praise your child for doing things well at school and in sports. Yes.
Definitely true. I see a lot of times, I have a 7-year-old myself, so I see a lot of times in sports that parents are so negative. They scored a goal, they shot a basketball, but they're first telling them what they did wrong instead of cheering them and bringing them up, saying, "You did so good." They want to bring and talk about all the negative, and they're so young. I mean, bringing them up when they did something good means so much to them.
Yeah, building that self-esteem, not devouring it.
Yeah.
All right, next question. Give examples of ways you can help your child stay healthy. List as many as you can. Yes.
So again, not having pop or sugary foods in the home is important, and parents should be buying like fat-free milk or 1% milk and low-fat dairy foods, including at least 5 servings of fruits or vegetables every day for both meals and snack time, and then eating as a family. Like, I know life gets busy and we kind of do a lot of on-the-go stuff, but eating around the table as a family is important at this age.
Helps build that kind of emotional support.
Yes.
All right, very good. All right, last question for this category. What is an appropriate structure for discipline? Yes.
I think with this is just being able to explain to parents that they need to set appropriate boundaries and then consequences for whatever they're doing inappropriately. So not spanking, hitting in the abdomen. I mean, I've seen in the office where parents get mad when they were spanking because they were having trouble doing things, being able, timeouts or, chores, something appropriate for depending on, what they did wrong.
Taking away some of that screen time.
Yeah.
Is also a nice consequence.
Yep.
All right. Last category is screenings. Question number 1. Name an appropriate screening questionnaire that helps to identify ADHD in school-aged children. Yes.
The Vanderbilt assessment scale.
Very good. All right. Second question. True or false? Is it appropriate to do a PHQ-9 in a school-aged child that has signs and symptoms of depression? Yes.
True.
Very
We
good.
should be, again, assessing for these things, asking those questions, because again, social media, they're seeing all of these things, and suicide is on the rise. So we need to prevent that as much as we can as providers.
Excellent. Number 3. At a 10-year-old visit, there are 3 main screenings that should be completed. Can you identify these? Yes.
This is a 10-year-old visit, so we definitely want to do hearing and vision. And then at this age, starting to implement lipid screenings.
Very good.
Starting to get baseline on that.
All right. And last question for this category, and last question for the game. During your physical exam at a 10-year-old visit, name 5 important things to look for. Yes.
Height, weight, and BMI. We still want to be looking at their growth chart at this age, on the CDC growth chart, and monitoring, that they're following their curve. We want to look for signs of self-injury, such as, again, cutting, or even signs of abuse too, like the bruising on the abdomen or the back, or not easily seen places. We talked about puberty is happening in this age group, so we want to look at Tanner staging, and then we want to screen and look for scoliosis, so we want to do a thorough assessment of the spine too.
Good. All right. And that is it. You guys did well.
Sweet! Woo!